right. Good morning and welcome everybody to the Health Transformation webinar. This is going to be an awesome webinar today. We're going to be diving into some really cool stuff with what's happening with the Pain Revealed documentary, as well as we'll talk about how to avoid opiates and look at some things that really are going to be transformative for treatments. So with me, we got the original OG. We got Regan Archibald here, and he's with us. He woke up bright and early just to hang out with us this morning, because he's still in Hawaii. Last day there. So this is going to be really cool though, because it's 5:30 a.m. where he's at, and he just wanted to make sure everyone was able to see his bright shining morning face. And we're gonna play some really cool stuff today though. So Regan, how's it going?
Really good. Yeah, 5:30 and I'm ready to rock. But last night I was watching our interview on Pain Revealed, and today our topic was going to be on the opiate crisis and how surgical procedures can lead to that addiction that is sometimes debilitating. It can sometimes take out people's lives. I mean, I've had several patients throughout my career who have been completely addicted to opiates. And so Steve's interview on Pain Revealed last night was arguably one of the best interviews of the entire series. And I've been keeping a pretty close tabs on it. It's been pretty awesome to be on vacation where I have free time the day that the docuseries was released. And so it was timing couldn't have been better, because I couldn't have fit it in any other way. And so we're going to play some of that. But before we do, Cade, if you look at the opiate crisis, what would you guess that there's more deaths from opiate overdoses or car accidents every year?
Well, when you ask that question, my initial instinct is to say is car accidents, but I actually know the answer to that, and it's not.
Okay. Yeah. Isn't that crazy?
Wild.
Yeah. More people die from opiate overdoses than car accidents. And, if you look at this, the speed limits are everywhere. Slow down. We have the signs above the freeway like, hey, buckle up. We have no death. We don't want any deaths this year. And on I-80, when I drive up Parley's Canyon, it's like, okay, here's how many deaths are, tallied for the year. And it's like crazy, right?
Yeah.
And that's what we need for the opiate crisis is like, hey, don't get on this stuff in the first place. And I think what you're going to see in Steve's interview is, and Patrick Gentempo does a great job of just pulling out the essence of Steve's former career working in the surgical field. And then as Steve's transformation occurred with regenerative medicine, the primary feature of that was the patients who didn't get the results from surgery and the patients who also were stuck on these medications that Steve just didn't feel were right. And so maybe we can jump in and we'll have some dialogue as we go throughout that. But everyone want to hear just like a little bit of a take on this? I've got it ready. So
I love it.
Okay. And for those of you who
I'm going to ask the audience here, did you guys all, has everyone had a chance to get on the Pain Revealed? So I think a few of you on here, I don't know for sure if you've had a chance. All right. Key, you got to get on there. I'm going to post a link here and you can register there. Give me just a second, and I'll have that link set up for you guys, so you can at least hop in and take a look. But I'm excited to watch this section, because I just watched a glimpse of it last night, but I was with my kids and a little distracted. So let's dive in, Reagan. I'm excited.
Yeah, here we go.
to Stephen Cox. This is a guy that utilizes this.
Can you hear that okay?
Every single day, and you're going to learn some things about this.
Sounds great.
So, Steve, thanks for taking some time to sit down and talk to us today.
Yeah, happy to do it.
Yeah, and I got to watch you work a bit today, so it was kind of fun seeing you do your thing. Tell me about your background. How'd you get involved in what you're doing?
So after I graduated from physician assistant school at Eastern Virginia Medical School, I got right into orthopedic surgery. I did about a decade's worth of orthopedic surgery.
What kind of stuff would that include?
So that was mostly joint replacements, ACL reconstructions, sports medicine, but I also did foot and back, shoulder, knee, and you name
everything.
I did it, yeah.
And you were like, so you would be working with the orthopedic surgeons in all these procedures?
Correct, yeah. Usually as first assist, right across the table from them, helping them with anything they need.
And then from there, what happened?
So I moved here to Utah from Washington State. I got in with a good surgeon in Cottonwood Heights. We did a lot of really good procedures, but I was starting to see more and more of my patients just being unhappy after their surgeries. Total knee replacement, get a blood clot or an infection, or have to have a repeat surgery, and I really took it hard. It was very frustrating, and it was really sad for me to see patients coming back saying to me, Steve, I wish I'd never had the surgery. And so we started getting into stem cells. Actually, me and that surgeon, we started doing stem cell procedures for mostly our young athletes who would have ACL reconstruction, PCL reconstruction, where we would do stem cell injections after the procedure to strengthen and help the ACL heal faster. And then we started thinking, well, what if we did this prior to surgery for people who had like partial tears, partial rotator cuff tears, partial ACL tears, and keep them out of surgery. And so we continued to do that. I did that for about a year, and then decided I just wanted to get out of the surgery scene altogether and get into regenerative medicine full time. So I found East West Health and have been doing that for almost a year now.
And has it lived up to your expectations? In other words, you had a certain anticipation, I imagine, coming into a new environment, a non-surgical environment, and starting to do this regenerative work. So was it better, worse, what you expected?
Well, I'll admit, being trained in Western medicine, I was a little skeptical, of acupuncture, of things like that. But, stem cells in general, we're not taught on it. We're not trained on it. It's something that hasn't been tested a whole lot, but they're doing it right now. And so I was a little skeptical to come in with, but I'm a believer now. I've come in, I've done the procedures, I've done the follow-up, I've seen people get better. Most of the people get better. And occasionally we have people who don't respond, but even then we'll do PRP for them, we'll do acupuncture for them, and in some ways they get better.
So this is one thing you spoke to, saying, hey, it's kind of new, you're not really trained in it. What kind of training is necessary to be, a good clinician to be able to, to do cell therapy in the way that you guys do it?
Well, Regan has a really good program here that you set up. We do a lot of patient education. And as far as training newcomers like me, luckily I'd already had stem cell procedure training before, as well as injection training and ultrasound training. And so now it's just a matter of learning the data and the research associated with the stem cells, which Regan took us all through it. And, we continue to go through all the research and see, okay, what does this help? What doctors are doing the research? What studies have we seen on Parkinson's, on Alzheimer's, on osteoarthritis, which is one of the most common things we treat here.
Yeah. And so the actual...
Yeah, so just pause real quick. So kind of an interesting, you can see Steve's evolution. And one of the things Steve talks about is this, just kind of the training. And, he mentions my name. I take him through. What I do is I just get the research and I go and seek out some of the best of the best in the field and try to bring it to our medical providers. Just to clarify, I'm not the one that is doing the training on the injections or ultrasound. That's done. I'm surprised Steve didn't mention Karen Rhea, because she does a lot of that. But pretty cool. What do you think so far, Cade?
Yeah, I'm digging it. We had a couple questions on this. So where does this doc work? So this is Stephen Cox. He works at East West Health with Regan and I. So for those of you that don't know, we have 4 different clinics across Utah, St. George in southern Utah, and then Highland area, and then Salt Lake and Park City.
Park City.
We had a couple extra people join since we started the video, just to let you guys know what we're doing. If you haven't seen this clip, it's a really, really cool clip. This is part of the Pain Revealed documentary. I posted the link here. Hopefully this works. This is like a tracking link on there. So if it doesn't work, type me in a chat box. Yeah, and we got some comments here. My joints are fine. Stem cells. Kick A from my brain, though. I love that. Thank you for sharing that, Laura.
Wait. Is that Laura? Laura? Oh, hey, Laura. Good to have you on. Laura is amazing. Laura's one of my favorite patients of all time.
Oh, nice.
Good to have you on, Laura. And you did kick ass for your brain. Well done. Yeah, I'm so happy she was able to get that done. So Laura is a constant, like, she and her husband go to all these cool concerts in Salt Lake. So.
Oh, that's cool.
Good to have you on.
Well, glad you joined us today, Laura. So, we'll dive back in here, but this is really cool stuff. If you guys haven't had a chance to start watching the Pain Revealed, we got like 2 or 3 or maybe 4 episodes left. I think there's 12 total. And it's free viewing right now on each of the days. So you got 24 hours to view each episode. So dive in and take a look at this content. It's really, really cool stuff.
Yeah, they do take them down pretty quickly, but literally every day we've had at least one of our patients in there. I was in episode 2. They did about a 40-minute interview with me, and now we got Steve. So here we go. We'll keep going.
Delivery of the stem cells, the injection process, that's something I guess you've been doing for a long time as far as, doing needle injections, as an orthopedic PA. I imagine you've been doing a lot of that in the past.
Yeah, over a decade.
Yeah, and because I noticed too, you're using ultrasound to help guide the needle, find the locations, you're marking them. There's a procedure and a process saying, this isn't this guy's first barbecue here. He's kind of done this a few times.
That's right. Yeah, and it's easy to not use the ultrasound when you've done as many injections as I have. But I think the ultrasound really provides a good point for the patient to see, okay, this guy knows what he's doing. He's using the ultrasound. We're having a second image inside the knee so we can see where the needle is going. Do I absolutely need to use the ultrasound? No, but I think it's a good idea.
Yeah. So the pushback I get as we've been pursuing this has been, people aren't really trained that much in stem cells, and they're not, their people are kind of like it's the wild, wild west, and people are just setting up shop and doing it, etc. So that's kind of the controversy, because in some respects I'm looking at patients who are not well healed. This is a big investment for them,
right? And
they're going in and they're getting the procedure done, but they also have tears in their eyes telling me about how it's changed their life, or maybe even saved their life to a large degree. And then on the other side, I've got sort of these skeptics saying it's not validated, it's not proven, and people aren't appropriately trained in it. So how do you see it in this whole world of stem cell therapy?
Well, I think there's definitely clinics like that where they set up shop. Maybe they're not trained as well as they should be. They're just injecting the stem cells, and we don't know exactly where they're getting them from, and then they send them out the door. That's why we focus here on a full whole body holistic program where we look at the body head to toe. We run labs. We combine Western and Eastern medicine. We make sure we get the results because we have a healing stack. We do stem cells, then we do PRP, then we do acupuncture, then we do PRP, and maybe a booster stem cell later on if they're still having some issues. Yes, it is an investment, but it's an investment in your health. It's an investment in your body, which you're in 100% of the time.
Now, you said earlier, one of the things that became almost discouraging for you, and it's interesting to me how much you care, because a lot of times people are maybe somewhat indifferent or feel like they have to be. But when you're doing the orthopedic work, and how many people would literally have regrets about having the surgery, and that almost moved you out of the field, in a sense, is the opposite happening? From your own personal experience, and now I'm sure you've done a lot of injections, a lot of cell therapy at this point. Mm-hmm. Are you seeing like, wow, the vast majority of people are getting a pretty decent result?
That's exactly what I'm seeing. It's not 100%, and like I always tell people, there's no guarantee in medicine. Just because we can't know everything. We're trying to, and we're making vast improvements all the time. But what I see is the vast majority, at least 85-90% of the people that we treat here with stem cell therapy get better. It helps them in some way. And I always tell the patients, because they always ask, well, how do you know the stem cells are going to help? I said, they're going to help. I just don't always know how they're going to help or how much they're going to help, but they're definitely going to help you. And sometimes we need a little bit more, or sometimes we need to do some PRP, but they're going to help you and you're going to get better. And that's what I've seen, is that the vast majority, at least 90%, are better.
Now, is the descriptor stem cell therapy, is that adequate, or is that maybe a little bit of a misnomer? Because as I'm hearing you explain the components of what you're injecting into the patient, watching you, do it with the patient, you're talking about a bunch of other cells that aren't stem cells, and that it almost seems like a minority of the cells in the solution are actual stem cells, and there's all these other things in there. So can you speak that a little bit? Sure.
So we get our stem cells from Utah Cord Bank. They're from C-section deliveries, from the perinatal tissue, scheduled C-section deliveries in the surrounding local hospitals. And of course, not all of them. I mean, you can never say that all of the cells are stem cells. And so the vast majority of the cells that we get in 1 cc of product from Utah Cord Bank is proteins, cytokines, exosomes, a lot of healing factors, growth factors, some other cellular substrates, and then probably about 37 to 33 million cells out of the 40 million cells that are in this 1 cc. About 3 to 5 million are probably the live mesenchymal stem cells that we get directly from the placental tissue, the Wharton Shelley, and the cord blood.
So these other cells, though, play a role, or maybe even an important role, in the actual outcome or the healing as compared to just the stem cells?
Yeah, they play a huge role. They're actually the major components that are in PRP. And so PRP has been used for decades for multiple injuries, including rotator cuff tears, patellar tendon tears, things like that. And so
Okay, just a quick side note that you guys may find interesting when Steve talks about the other types of cells in there. One of the things that has been shown in abundance in the perinatal tissue is endothelial cells. And in May, out of Denmark, out of Copenhagen, University of Copenhagen, what they discovered is endothelial cells in the perinatal tissue, or endothelial cells in general, when they're young cells, they can transdifferentiate and they will become MSCs, or they'll become stem cells, which is really interesting findings. So we're starting to realize there's all these signaling cells, and it's not just the MSCs that we want to look at, but even the endothelial cells. Okay.
Want all that good stuff. That's all the goodies, right? Because that's what helps us to heal. That's what helps our body to heal. The stem cells just add another level on top of that, because they actually can replicate and become new tissue, become the tissue that's been damaged or lost. And so not only do we have all of that good plasma, all those proteins and cytokines and healing factors, now we have the stem cells on top of that as well. And so it's all very, very important.
So if I'm someone who's considering this procedure, I'm suffering from pain, been told maybe I need surgery, I would like to not have surgery, and I'd want to try something else first to avoid it. And I'm researching, where do I want to go have this done? How important is the actual source materials that a center gets? Like, what should I be asking?
The source material is crucially important, because you don't want to go somewhere, have them inject something into your body and have it be just nothing, right? Placebo, right? We know placebo effect works, and there are some clinics that are doing that. Which I have a big moral issue with. I want to know that if I'm going somewhere for stem cells, that I'm actually getting live stem cells, that they're actually going to do something. Right. And so you have to question, okay, where are you getting your stem cells from? What lab are you getting it from? Has that lab been tested by the FDA or by a third-party lab to say that, yeah, your cells actually are live? Right. If it's just we get them from, who hasn't, we don't know where we get them. I mean, how can you know that the cells are real? How can you know that they're alive? Right. And this was something that Regan talked about, and he actually did a lot of testing on about 4 years ago.
So when you say you did a lot of testing, you do your own testing to see if what's represented versus what you got is the same thing?
Well, sure. And his take on it was, well, I have all these companies coming to me saying, hey, use our stem cells, we're the best, right?
Kind of like the pharmaceutical companies trying to sell you their drugs, right? Yeah.
Exactly. And so how do you know who's telling the truth? How do you know which ones are the best? So he actually got a third-party lab in Seattle, Washington, to test a bunch of samples of different companies, different labs, to see who had the most live stem cells, if any, who could form a colony unit, and who was viable. who had the most cells. And what it came back at was actually quite a few of them had cells that were not live at all. Post-thaw, they were just dead cells.
Wow.
And not that that's a bad thing. I mean, they'll probably still help you because it still has all the healing factors and everything, but there's no live stem cells there, right?
So it'd be a misrepresentation to say, hey, you're paying thousands of dollars for stem cell therapy, but there's no live stem cells in what you're doing.
Right. And unfortunately, that's we saw in some of the samples that we got. And what we found was actually the best sample that this third-party lab, Da Vinci Labs, told us was Utah Cord Bank, right here in our backyard, which was not a cord bank we were using at the time. We were using one from Texas. Yeah. And so they said, they had the best, most live stem cells post-thaw, the best volume, and were able to form an actual colony on their assay, which is great because that means they're actually becoming something.
Yeah. And when you talk about thawed, so this stuff comes in frozen. So I guess what happens is that when they harvest these materials, they freeze them pretty instantaneously, and then you guys see what happens once it's thawed, what survives.
Right, exactly. And there's a whole process. They have a time window from the time that the tissue is delivered to them. They get it to their lab within 10 minutes because stem cells don't do very well outside the body or outside a controlled environment. And so they get it to the lab, and now the more tissue you have, and the more in depth you do the cleaning sterilization process, the less live stem cells you're going to have back. If you sterilize too much, no live stem cells, right? So you have to sterilize just enough and just take the top 2 layers of the placenta only to get those mesenchymal stem cells, and then immediately cryofreeze it so that we can preserve the viability of those cells.
So what is the biggest surprise you've experienced, since you've been doing this for the last year here?
The biggest surprise is some of the worst knees that I've seen in my entire career. People barely being able to walk, lots of pain, are getting better. And not that they're like they were when they were 20 years old, but they're getting better, and they can walk better, and they can function better, because at the end of the day, that's all that matters, really.
Would these have otherwise been surgical cases?
Oh, for sure. I mean, I had one gentleman come in who said, I have surgery scheduled for next week, both knees. And I don't want to do it. I'm scared to death. What can you do for me? I looked at his knees. Of course, he's bone on bone, both knees. He's walking, he's only 62, walking like a 90-year-old, hunched over on a walker. And I said, they're pretty far gone, but we'll do the injections. I think we can make you better and not have to have that surgery. We did the injections the next day. I saw him. Then the day after that, he came back for acupuncture. He was walking without a walker. He was using a cane.
Just the next day?
Just the next day.
And normally it takes longer than that, or?
Normally it does. But again, these stem cells that have a natural anti-inflammatory effect. And so they immediately bring down the inflammation in the joint, so the joint feels better. And so he's doing great. I saw him a week later, not using a cane at all, standing up, sitting down, standing up, sitting down. Again, this is the anti-inflammatory effect. It's just, but the stem cells build on that. See, if we have that inflammation out of the joint, then the stem cells can build on that and just keep healing the joint. And 3 months, at the 3-month mark, I saw him, he's doing great. He'd lost 20 pounds thanks to the diet, right? But he's also exercising more because he can walk, he can move. He's like, I can get on my treadmill now and walk, whereas before I wouldn't even try, And so 6 months, I just spoke to him on the phone. I think it was 2 weeks ago, doing great, still going. He's sticking with the diet, him and his wife. He's lost weight. He's moving better. He canceled his surgery. I mean, these are things that before he would have came in to see me at the clinic, I would have been like, wow, yeah, you need surgery. Let's sign you up for total knee replacement, which is what they did. And now he's surgery-free and exercising and living a better life.
I mean, total knee replacement's a pretty brutal surgery, right? I mean, that's
it's invasive.
Yeah.
It's a fairly large incision, and you have to cut the bone and replace it with metal and plastic.
Yeah. So it's a no little thing.
No, it used to be a week in the hospital.
Wow.
Now they've got it down to be a same-day surgery, which is great. I mean, they're making strides and progress, but still, it's a big surgery, not without its risks.
Wow. So do you love your job now?
I love my job now.
Yeah, I mean, it's like gotta be exciting to show up and see these kinds of results. I mean, it's pretty dramatic.
I mean, it's wonderful. It's wonderful to see people get better and just be super, super happy that they didn't have to go to the surgery. I mean, it's a lot of anxiety off of them. Right. It's anxiety off of me, because I can help them with a minimally invasive procedure that can actually reverse the damage, the aging process, the degeneration, and help the cartilage and meniscus heal back.
And then with the collateral things, like you said, if they're changing their diet, they're changing their lifestyle, they're getting acupuncture. Do these things all kind of synergize with each other?
They do. And I think if you're looking for a stem cell clinic, you have to look at one that looks at your whole body. You can't just be, I'm going to stick stem cells in you. They're the miracle magic bullet and send you out the door. That's not the case, really. They work wonders, but they have to have a good environment to work as well. And so that's why we have diet coaching. That's why we do labs and genetic testing. That's why we do functional medicine and coach on vitamins and minerals and herbs and natural holistic treatment remedies that can get the body healthy. Because we need a best environment for the stem cells to work the best.
Well, I got to tell you, Steve, your enthusiasm for what you do certainly bubbles through, and I appreciate you sharing your story because it really tells more about what this all means because of what you've seen and now what you're doing. So I thank you for sharing all of that and being here with us today.
Oh yeah, happy to. Thank you, Patrick.
It's really interesting to see this point of view, right? This procedure is evolving over time. And when you talk to somebody who's been doing it clinically for a while, you start to get a sense of what the trend is. So I really appreciated Stephen's time and the knowledge that he shared.
All right.
Man,
So
that's awesome.
Isn't that cool?
So cool. Yeah.
Yeah. There is, Steve just nailed it. And so hopefully everybody enjoyed that. If you haven't watched Pain Revealed, you got to get on there. It's really fascinating. But like I mentioned earlier, I think of all the interviews, Steve just really brought it home. Our philosophy at East West, I think it's like all encompassing. Let's take care of all the major issues and really help transform people's lives, their health. But really exciting to see. So, Cade, any final thoughts on that? I know we're out of time, but
no, I had a couple questions come in. Do you want to answer this one real quick? I'll just read it to you.
Sure.
I had a bilateral TKA earlier this year. I sustained nerve damage in my lower legs. SP injury to my sphenius nerve from my femoral block. My work was done in March of this year. I need to wear a compression sock in the leg. What are your thoughts on cell therapy in my case? Could it heal my nerve?
Yeah, I think there's a really good shot at that. And what's the first name of this person, Cade?
Donna.
John, I think, we'd want to do an assessment, absolutely, and see if this is something we can help you with. But there's got to be a couple different things. So cell therapy will lay down some new foundations. It will get rid of some of the trauma to the area. But then the other thing that we would want to do is ozone therapy. We found that ozone is coupled with stem cell therapy can really maximize your healing capabilities. So absolutely.
Awesome. And then we had another comment from Laura. Stem cells aren't just for joints. Thanks for that, Laura. Yeah, you can use them a lot of different ways.
Yep. Nerves, brain, overall body, reset the immune system. Yeah, they're amazing. All
right. Well, thank you guys so much for joining us today. Regan, that was awesome. And thanks for waking up bright and early in beautiful Hawaii to hang out with us. It's now 6 a.m. where Regan's at.
Yeah, my pleasure.
He woke up to join us today. I'm really excited to have you guys on. We'll be back same time, same place next week. Maybe we'll be diving more into the opioid crisis and everything next week. We just wanted to share that clip while it was live because they're going to be taking that down very soon, so we won't have that immediate access to it. And so, but you can go in. I recommend get on the Pain Revealed documentary. I posted a link up in the chat box, so hopefully you guys saw that. Maybe I'll I don't have it on my clipboard anymore, but yeah, scroll up and you guys can get registered for that. But love you guys so much. Thanks for joining us today, and we'll see you next week. Bye-bye.
See you guys.